Hello guys, welcome back to the Closer Look Project Referral Network Training Program lecture videos. Super excited that you're here, and if you made it to chapter 3, I think that now for our personal care professionals, you will start to see a lot of really good information that can be really applicable to you and your profession. So chapter 3 is the systematic skin exam. For the agenda, we have the stepwise exam process, why it's important, do not miss areas, tools and checklists, and then takeaways. So for the objectives, we are going to learn a systematic process for a thorough skin exam, understand why certain areas are at a higher risk for skin cancer, and then identify common do not miss areas where skin cancers may be prone to hiding. I hope that these objectives are attainable for you, and I would love to have your feedback upon completion of each chapter. So why are the steps important? Well, steps lead to a destination, right? And so missing one may result in a situation like this guy here in the photo. You may fall. And so we follow steps for that reason, to make it to the destination or to complete a journey with ease. The steps are there for a reason. Don't skip them. So the types of assessment. So there are two primary ways of assessing someone. And as a provider or a professional, you probably already notice something that seems off if there is something in that way. And so for hairdressers, you may be drawn to jagged edges or bangs or a bad color job. For nail techs, you may notice chipped nails. Dentists may notice a crooked tooth or a chipped tooth. And for dermatology providers, we often notice an obvious lesion or a growth as soon as we enter the room. So I know from practicing, as soon as I walk in, if I see a huge squamous cell carcinoma on an arm or a leg, my mind automatically just zooms in and focuses there, which can be good and bad, which is kind of why we do two types of exams. So when you first see someone upon entering a room and you just kind of take a glance and make sure that nothing looks abnormal, that is your macro scan. And so that's just taking a pass, taking note of anything that may be unusual. The second exam, or the second pass, is a micro scan. And that's where we perform a detailed inspection of each region, which includes those hidden areas or the commonly missed areas. And we will get into that very soon. So what is more important? The scalp or the arm? The ears or a finger? It's a hard question because they're all important. They all have a very important role. But remember that macro scan that we talked about? You will likely notice a strange growth on the arm, but the scalp is likely out of your immediate view. So while all regions are important, there are those areas that require a bit more intentionality, and so those are what we will focus on today. So for the body scan or exam, which part is more important? You must ask yourself first, which regions are the most neglected, or which areas receive the most sun exposure? And then you will have your answer. Head, shoulders, knees, and ears. Ears are important because of the unique anatomy that's involved and because sunscreen is often forgotten when it comes to the ears. So those grooves, nooks, and crannies usually will make the ear a bit more complex than a typical quick glance will just take care of. We must look behind the ear, the conchal bowl, beneath the antihelix, the helix, behind the tragus, behind the earlobe, and the preauricular region. Ears are just constantly being hit with sun exposure. And if you don't believe me, ask your car, ask your windows. The scalp. So how many of us know a grandpa or a great uncle with a ton of scaly spots on their head? Those are not barnacles, as the older generation will often call them. They are actinic keratoses, and 1 in 10 will become a squamous cell carcinoma or SCC at some point in their life if they're left untreated. So who do we consider at risk when it comes to scalp damage and lesions? So you want to think about exposure and sunscreen. So women who have a part in their hair, a blonde color, or if they're bald, men or women. And of course, men who work outside without hats, or those who live in sunny regions like Florida, athletes, and people who drive convertibles. And there's no shame to the 50-year-old man who just bought one, but you have to think about the exposure. So next is the hands. So why are the hands at risk? You have to think about the exposure risk associated and the biomechanics of the hands. So the number one reason that they are at risk is because of exposure. For those of us who drive, or especially who have a long commute, or those who may travel for work, your hands are always exposed to the sun and their harmful rays, as you can see in this photo. And even if we do apply sunscreen, due to the functionality of the hands, sunscreen doesn't often last very long. So we should always be thinking and encouraging our clients or patients to diligently reapply and be conscientious of this. Does anyone remember seeing this image? This is a 69-year-old man who drove a delivery truck for 28 years. Take notice of the left side of his face. It looks much older compared to the right. This condition is known as unilateral dermatoheliosis, which is from chronic sun exposure, specifically UVA, and it causes destruction of the skin's elastic fibers in the top layers, which include the epidermis and dermis. As the issue and the tissue damage occurs, the risk for cancer development increases drastically. And I will drop the link for this article if you would like to read it. So that delivery driver leads me to tell you about the face. I always tell this to my patients, your face is always exposed to UV, whether you know it or not. Many of us may think that our cars are safe spaces, but for drivers, the left side is chronically exposed, and for the passenger princesses, the right side is chronically exposed, as we previously saw from the truck driver. So it's our prized possession, right? The face is the first thing that most people see. It's the source of our pictures for our selfies. It's our entire identity, physically anyway. So we should take care of it. I cannot tell you how many times I would have consultations for cosmetic treatment for women or men who are 45 and up because they feel that their skin is no longer reflecting how they feel on the inside. And I'm not talking about wrinkles or natural signs of aging. I mean the avoidable visible sun damage that occurs with that chronic exposure. Those include actinic keratoses, sunspots, also known as solar lentigos, and God forbid scars from surgery after a malignant lesion appears and is removed. Do not miss areas. What does that mean? Shouldn't we not miss all areas? Yes, that is true, but there are certain areas that skin cancers and abnormal growths just may occur that we don't think about as often. And so those areas include the conchal bowl of the ear, the postauricular region, which is behind the ear, skin folds, beneath the eyes in that lax skin, nasolabial creases, which is this area here, the elbow, and of course between the fingers and toes, also known as the interdigital space. Some of these areas don't get as much UV exposure as much as the others we've mentioned anyway, but they have been well documented to hide a melanoma or two, so you should always look. Now we get to look into some of my favorite parts of the referral network training book. These are the tools and checklists to support our partners in that referral network program. So checklists can be tedious, but they also can be life-saving. As discussed in Chapter 2's video, this is the melanoma reference card that we designed with the Closer Look project. It can be used to determine the need for reassurance versus a biopsy. I will typically say that if a mole will meet 2 out of the 5 criteria, then it's worth a biopsy, or at least a referral. A is for asymmetry, B is for border irregularity, C is for color variation, D is diameter greater than 6 millimeters, or the size of a pencil eraser, and E is for evolution, if it's evolving or changing over time. The next tool is the Sun Map tool, which the Closer Look project developed. It's a way to ensure that you are performing a systematic exam. It stands for scalp, under and around ears, nasolabial folds, metacarpals/hands, arms, and palms to include the soles and between the digits. So the takeaways from this chapter are that a structured exam will reduce missed lesions 99% of the time. High risk and hidden areas deserve extra attention. And using checklists like the Sun Map will standardize your approach every time. Thank you so much for joining me for Chapter 3 of the Closer Look Project training program. Please send me an email if you enjoyed the content. Check out our website and our socials as well. Let us know where you're watching from. I would love to hear from you. So also, to purchase the full text via PDF or physical copy, head over to our website at www.closerlookproject.com. Hope to see you next week. Bye.